So here's Lucy Reynolds to talk about public services and PFI. Thanks.
Good afternoon. For those of you who haven't met me before, which probably isn't very many people, I am somebody who used to work in the city on privatisation, and then I found myself fighting privatisation and studying privatisation, and I really didn't actually want to carry on working on privatisation. I'm also a former humanitarian aid worker. What I've been doing is patching together services in countries which are post-privatisation. So they used to have health services and now they don't. And people like Médecins Sans Frontières hire people like me to go and put things together for them. But I came back to this country for family reasons and then started to discover what was happening to the NHS and was really, really horrified by it. Because, as with a lot of privatisation things, the narrative that we get about what's happening completely doesn't match the laws. And that's what got me concerned about it. I'm a chartered accountant originally, and I thought it was very interesting, the comments earlier about the mismatch between the true way subjects are taught and the way they're being taught in our universities at the moment. Because I've started to teach health economics at London University. And I've been very disturbed by the distortions between the way I was taught it, the work straight up in the city, by the city's educators, so that I could do the work right, and what's being taught in universities, because there are an awful lot of inaccuracies in there and they all are skewed in the same direction. So I am commenting on this from the point of view as somebody who comes in from that background as a technician, and I also have a doctorate in public health, so that's the world I work in these days. And Linda's asked me to speak specifically on the NHS. Next slide, please. Right, okay. Previously, the largest privatisation in this country was the right to buy. That was only 40 billion, spread over 25 years. The NHS privatisation is double that every year. We are spending over 100 billion on the NHS every year, and that is the prize that the city is after and Wall Street is after. Plus, people don't seem to be aware of the details of the privatisation plan, but there is the intention of privatising 1/3 of our hospitals and selling the rest of the sites for redevelopment, which means they're going to get rid of an awful lot of land in this country, and that land is worth an awful lot of money. So the point is that the prize for the NHS privatisation is absolutely huge. Now, when you speak to the people who are promoting TTIP, they will give you a whole load of waffle about how this is going to be terribly good for the car industry or some such. The truth is that in terms of this country's contribution, our government's already privatised everything years ago, except for the NHS. This is the only substantial thing in the deal for the UK and TTIP. So whenever you hear, oh no, the NHS isn't important, that is a flat lie. It's the only thing of any size that's up for grabs. People keep saying, why has nobody ever copied the NHS? If it's so fantastic, why has nobody ever copied it? Actually, a lot of countries have copied the NHS, and everywhere it's been tried pretty much, it's been a big success. Other countries have done other kinds of things. And what I've done is for two headline health indicators at national level, which is lifespan of the people in the country and the infant mortality. So that's babies that are born alive that subsequently die, the rate of those. It's possible to get data, which I have taken from the OECD, on those survival statistics and then plot that against the cost of health systems. So the next couple of slides are going to show an actual international comparison, in fact two international comparisons of health system performance. Right, this up here is the life expectancy across the population. This is the cost of healthcare, and it runs from $0 per year purchasing power parity up to 9,000. So that means it's evened out depending on the different cost of living in each country to make it more comparable. And you can see a scatter of sort of middle income countries coming up here. Up here you've got the best performers in the world. So you've got Japan and Israel, Spain, Italy, Iceland up in this area. Out here on the far side, you've got the most expensive health system in the world, almost $9,000 a year it costs, is the USA. But the lifespan that it generates is about the same as Chile. So its performance as a health service is coming in at the range of middle income countries, but it just costs more than twice as much as anybody else's health service. And you can see a scatter also across here. As the cost of health service goes up in this portion of the graph, you spend more money, you get more health outcome for it, because those are public systems, publicly owned, publicly run systems. As soon as you start privatising and marketising and all of this kind of stuff, what you find is the more you spend on the system, the worse the performance gets. It's the same plot, you can see the same shape going on with the USA as an outlier, as a really poor performer. More of their babies die per year than any of the first world. So they're again in par with middle income countries, Turkey and Mexico and Chile, but they are underperforming all of the European systems, all of the first world systems. Now I find it very interesting that this is what we're supposed to be copying. That they're trying to get us to copy that one, not to copy these ones up here that are cheap and well performing. We're going to copy the worst performer. Next please. I'm putting into every presentation now what it is that's happening to the NHS, because people don't understand it. So for the hospitals themselves, what's happening is that hospitals have been put into foundation trusts, so they are allowed to sink or swim financially. And then they're loaded down with PFIs, so that they're bound to sink financially. The PFI hospitals have been built in such a way that they suit the private sector rather than the public sector in any case. So all of that preparation was put in before 2010, then the coalition came in, squeezed the budgets, feeding the hospitals with funds, and what do you know, they start to go broke and can be taken into privatisation. So that's what's going on with the hospitals. The next one, please. As far as the rest of the system is concerned, what's happening is that the insurance industry is being facilitated to take it over. There's a thing at the moment come out of the Labour Party called the Efford Bill. Clive Efford is a backbencher. And we haven't seen the wording of the Efford Bill, but we've seen the headline. And the headline sounds fantastic. We're not going to change anything in the system that's at the moment for stability, because everyone's sick of the restructurings, but we're going to remove all the competition law stuff. And everybody's fantastically happy about that, because they don't understand that the infrastructure that we've now got in place is designed to self-collapse into an insurance industry takeover. And the competition law rules that are in place were used to break the state monopoly of control over the NHS, but they need to be removed as an obstacle if what's intended is a private sector monopoly of the NHS. And it is. So what's going to happen is, as soon as the Efford Bill goes through, it looks as though it may well have cross-party support, judging by some of the press that's been going on recently. So what we're going to have is everybody's going to sign up to that, and the people will be happy because the NHS has been saved. But then United Health, who's the, if you have the next slide please, this chap who now runs NHS England, formerly a vice president at United Health, he's going to be in a position to get United Health to buy up all of the commissioning support units, and at that point United Health Corporation will control the entire NHS budget. So that's the plan. When you look at the Lotus Committee and so forth, you'll see just how incredibly important the insurance companies are. When I worked in the city, I was told, well, you know, we all think that the city's about banking, but actually it's the ABI, the Association of British Insurers, which you know, has the real clout around here. You can see they're important on Lotus, and they're about to inherit the NHS. The point of this was, I have a set of graphs taken looking for 2002, Unison prepared a listing of capital value of contracts, and they are talking about the big accountancy firms. There were 5 at that time. The smallest amount of money that any of those accountancy firms made out of PFIs during the year 2002, 2 billion. The highest of the 5, 22 billion. Total around 50 billion spent from public money going to accountancy firms to advise on the PFIs that are now taking the NHS down. The second slide looks at donations to political parties from accountancy firms, and there the numbers are a lot smaller. In exchange for their billions of money coming in from the taxpayer, they are putting around $500,000 each to the coalition over the year. I've got an 8-year stretch, 2004 to 2012. The point of that really is we've got the city's branding at the top. We've got a nice young lobbyist who I will talk about a little bit more, Mr. Nicholas Clegg, and we have another city lawyer. Really, our government and the City of London are completely intertwined. They seem to function together. I just wanted to stress to you that these are not separate entities. We've seen the policies coming in from Lotus to the government. That the government is an operationalising entity which actually implements the policy given it by the city and pretends to implement the policy given it by voters. That seems to be the actual score. Just a couple more. Next one, please. Right, now, in the picture on the left, we have a very high-powered trade and competition law official and advisor. Her name is Miriam Clegg, or Miriam Gonzalez Durantes, and she married this bright young lobbyist, Nicholas Clegg, while she was in Brussels working on EU competition law. She's not only a global expert in EU competition law, she also has written WTO trade legislation, trade laws, and she has served on a WTO tribunal. So Miriam Clegg is very, very highly connected in this world. She's currently, I believe, a partner at US law firm Deutschert, but before that she was a partner heading the competition law section at global law firm DLA Piper. Now, DLA Piper's clientele is mostly transnational companies, big American corporations very largely. And DLA Piper is now run, the London managing office, so the UK operation, is run by Lord Clement Jones. His speciality is government lobbying. So we've got a competition lawyer in partnership with a government lobbyist, and Lord Clement Jones, as well as that, also is the treasurer to the Liberal Democrat Party, has been for many years. He's been in trouble through putting people into the House of Lords that were his clients. There's been scandals in the newspapers about it. The Times went and asked him about it, and he denied all knowledge and then had to back down because they had evidence. So there's been some very interesting things going on with Clement Jones. And the most interesting thing from the point of view of the NHS was that he was one of 3 people on the Liberal health team, Liberal Democrats health team in the Lords. Judith Jolly, Shirley Williams and Clement Jones. And I was told by the leader of that team, Judith Jolly, that she and Shirley Williams just said whatever he told them to. He was writing stuff in technical jargon. You can see this in Hansard. Shirley Williams, who doesn't know about competition law, is coming out with a load of technical competition law arguments because that was important to get the Health Act through. So actually Clement Jones, probably more than anyone else, has done the legal work with the people in his firm, because his firm has a competition law department, an internationally high-profile competition law department. So that is what has been going on behind the scenes. These people from the city have got into our political parties and are using them to implement whatever they want. So that's the kind of mechanism that has been behind the Health and Social Care Act changes and the privatisation of the NHS. This is big business, this is the transnationals, that's who they're defending and who they're talking for. So lastly, I just wanted to mention what we could do instead of what the government is doing with the NHS, because they keep saying, oh, it costs too much, it costs too much. What we could do is get rid of the market out of the NHS, which serves patients not at all, and it's costing at least 10 billion a year. It's going to cost a lot more than that as we move into US health style system, because as you saw, the US healthcare system spends 2.5 times as much money per year as we do on a worse system. So really, by getting rid of the privatisation, we could end up with an NHS which is affordable permanently. If we don't get rid of the privatisation, the whole system is being repurposed to generate money, and we are going to find that the mortality rates shoot up for both adults and children in the 21st century. Thank you.